The ASD, atrial septal defect, there is a defect between the right and left atria, that is the upper chambers. So blood from the left heart comes to the right heart. When we need to close these, we very often enter through the right atrium and place a patch on this defect and close it with sutures. So this is an atrial septal defect closure. So how does it look when a surgeon sees it? When we open the chest, we see the right atrium between the diaphragm and the collarbone. The right atrium and the right ventricle are in continuity, and the left ventricle lies under the left half of the chest. So we connect the body, namely the aorta, the superior vena cava and the inferior vena cava, using three pipes known as cannulae, and connect the patient to a heart-lung machine which take blood out of the venous system. Thereby the heart becomes empty, and this blood is given back into the aorta, which supplies the whole body and keeps the patient alive. Once we know that the heart-lung machine is able to maintain the cardiac output and keep the patient alive, we stop the heart, giving a potassium-rich solution into the blood vessels supplying the heart muscle. When that is done, the heart stops and we open the right atrium. When we open the right atrium, we can see within it the hole. This hole is what we call the atrial septal defect, or ASD. To approach the heart, we would have opened a clock-like covering of the heart known as the pericardium. A piece of pericardium is what we normally use, and this is placed on the defect and is sutured in place. That is the ASD closure.